All right. Welcome back to the Abundant Practice Podcast. I'm your host, Allison Pereira, founder of Abundance Practice Building. I'm here with Shannon Heers at Firefly Supervision, and we are going to be talking about clinical competence in your private practice, like how to feel more confident, because this is something I see a lot of people struggling with. It's almost like we forget that we know what we're doing. Once we go into private practice, we have that imposter syndrome that spikes because we're doing something new. And it makes sense to just get better and better at what we do as we go as well. So thanks for being here, Shannon.
Oh, I'm so excited to be back and to talk about this topic. This is near and dear to my heart partially because I, of course, have struggled with confidence at different times in my career, but also because I provide a lot of supervision to therapists at all different stages. And that is the biggest thing that I see that therapists want to talk about, or that I notice in our supervision and even consultation sessions for licensed therapists. So very excited to talk about this today.
Yeah. So what do you attribute this lack of confidence to?
I think there's a lot of things that can go into it. There's no like, this is the issue and here's the simple answer. Some of the things that can cause challenges in our confidence as therapists are, of course, like if you're just starting out, you're going to have more challenges because you have less experience.
Mm-hmm.
But there are also many other times throughout a career that your confidence can be impacted. Say you are transitioning from agency work to private practice. That's going to be an immediate, like, I don't know what I'm doing. I'm not sure if I can do this kind of, confidence, maybe even crisis.
Mm-hmm.
Anytime you start to work with a new population, a new client population, anytime you get trained in a new modality or intervention or even full orientation and you're starting to apply it for your clients, your confidence level is going to dip down. So I think there are just a lot of different places throughout your career that you may be like, I just don't have the confidence to work with this population. I mean, that's excluding all kinds of personal stressors that we may have as therapists, like
Absolutely.
life events that just happen.
Mhm. Yeah,
You
I'm
know,
thinking of somebody in the party who just posted the other day of like feeling like she has to hide the fact that she got divorced last year because she's a couples therapist. And how like she knows what she's doing. She's been doing couples therapy for a long time, but all of a sudden this like sneaky whisper that maybe she doesn't because she went through a divorce came in. So it's interesting how those personal life things will invade.
right. Oh, it's too bad we're just not all robots, right? Like we're actually
Right.
human beings. We have lives, things happen to us, we get experiences that sometimes we choose, sometimes we don't. And it absolutely impacts our therapeutic work.
Yeah. Does it make sense for us to take these one at a time to kind of talk through them? Because I feel like there's juiciness in each of them.
Sure. I think that would work. Let me just touch really quick on some confidence research and then we can jump
Yes.
into
Ooh,
that.
yes.
So it's interesting on confidence research. Again, there's not just kind of one issue that, creates low confidence and not one problem. But what the research does say is that a therapist's confidence in their theory or their orientation, their approach leads to better alliance, better therapeutic relationships with your
Mm.
clients. That in turn leads to a more positive client outcome. So, more positive outcome from the client. And that in turn provides the therapist with more confidence. So it's kind of
Hmm.
like one step, then the next, then the next, and the next. So that's certainly one key is to feel really confident in what your approach is. And it may be several different approaches, but always, to know what your approach is when you're working, what you're pulling from and why you're pulling from it and why it's applicable to this client. So just want to throw that out there to kind of get us started.
Yeah, I love that. And I think that's a good segue into one of them, which is one I've definitely felt mid-career of you learn a new modality and you're learning to implement it in session and all of a sudden you feel like you're like learning how to walk. Like you might be a therapist for 15, 20 years and all of a sudden you're like, I don't know what to say next. Um, so can we talk a little bit about that? Because I think there's a messiness there because we also want to learn and grow as clinicians, but none of us want to feel like we don't know what we're doing.
Oh, I know it's the worst. Um, yeah, so you're really kind of talking about the practical application of the theoretical knowledge. When we get
Mhm.
trained or learn a new modality or intervention, we get so excited. Like, oh my gosh, this really resonates with me. This will really help with my clients. I can like see the outcomes. And then like you try to, you always feel like you're fumbling the first several times, even maybe first several months, maybe in the first several years, depending on, how complicated what you're learning and trying to apply is. And that doesn't feel great, right? And so that's
Mm,
when you take that hit about, I don't feel good. I don't know what I'm doing. So yeah, I think that's one of the challenges is learning how to practically apply it. Hopefully in some of your trainings, you're getting some practice, but that's probably maybe only an hour or two,
mhm.
and it's not like you're an expert already once if you've only had an hour or two's worth of practice.
Right. I think about like, I wonder how much it holds people back from learning new things because the last time they learned the new thing and implemented it, they felt dumb.
Mm.
Um,
Well, and then the
yeah.
opposite may also be true that people don't want to feel dumb, so they keep learning new and new things, and then they've like learned 4 or 5 new things over the past couple years, and yet feel very messy about implementing it. So they have all this training, all these new credentials, but then actually implementing it is challenging.
Yeah. Okay. So I'm thinking about, um, yeah, I think of them as like education chasers, right? Like most of the time, the people who come to me who are like certified in everything and or trained in everything, typically they're trying to feel confident. And they're like, if I just get more educated, if I just understand more, if I do this new modality, it'll be the one that unlocks my good enoughness.
Mhm.
And so that's something I often see with my students. Um, yeah, and the people who are like, I don't want to go back to feeling like I'm a freshman again. So I'm just going to stay put with this modality, even though it might not be the modality I believe in the most.
Mhm.
Um, yeah. Okay. So what was another one that you mentioned that comes up a lot?
Well, certainly kind of learning a new modality. Also, when you're maybe transitioning into private practice from an agency work, maybe you were more of a generalist in an agency work, or you were working with kids and you're like, I'm done working with kids. I want to work with
Mhm.
parents,
Yeah.
and so they transition into kind of working with adults in private practice. I see that a lot too. And it's literally like you're learning a whole new field.
Hmm. Yeah.
So it's not just the training and the competency and what you're doing, it's the knowledge base that you have of this new population that seems very shrunk compared to what you were working with before.
Yes.
You could be a
Yes.
star like social worker or a therapist in an agency, and then transition to private practice, and it is not what you expected it to be. You're
Hmm.
not feeling the way you're supposed to feel that, everyone idealizes kind of private practice. You're not feeling that great, this is for me, when you start doing it.
Yeah. You've got your learning curves with the business itself. And if you're changing niches, then you also have that like, maybe I worked with kids and now I want to work with moms. You've talked to lots of moms. Clinically, you know what you're doing with moms, but you really knew what you were doing with kids. And so it can feel like less confident as a result. You can feel less confident. And that's tough when you're also building this business and you feel less confident with your business skills.
Right, right. And then it all over just doesn't feel good, which is not where we want to be.
Right, right. Yeah. What else around? Like what else trips people up with confidence?
It's not even necessarily the skills and the knowledge sometimes. Sometimes it's just the belief in yourself that you can
Mhm.
do it.
Yeah.
I had a supervision session, just yesterday actually, with a younger in age and newer to the field therapist who was kind of saying, I just don't know how, I just have really low confidence working with this population. And it wasn't a new population to that person. This
Right.
was so we talked about it. For me, it was as a supervisor, just asking a lot of open-ended questions like, well, who have you worked with in the past that you felt really confident about? Just eliciting all that information. Well, what did you do that made you feel confident? What did you pull from that made you feel confident? And it was literally the transferable skills there were gigantic.
Hmm.
It was just the mindset about, oh no, now I'm doing therapy with this in an outpatient, private practice setting versus where I was doing it before. And so sometimes it's really just kind of tapping into, you really do know this information.
Mhm.
You really do have a level of comfort and familiarity, and even just talking with clients, I think research also shows that up to 30% of change in therapy is due to the therapeutic relationship. Well, now a
Mhm.
lot more research is coming out and they're saying, oh, that number, that percentage is probably way much higher. So even if you're just focusing on connecting with with your client for
Mhm.
several sessions, not even bringing in any kind of modalities, not trying to fix it, not trying to, jump ahead of where your client is at, then you're already winning. You're already doing a great job. So really
Yeah.
just kind of reminding yourself that, okay, what's the important thing to do? It's to connect with your client. It's
Mhm.
to understand your client. It's to show empathy and compassion and non-judgment to your client. The basic stuff that we learned so long ago.
Yeah, and it comes natural for so many of us too.
Right, right. And then
Mhm.
we just get caught up in like, oh no, I need to fix it. I need to do this. I need to do that.
Mhm.
So the pressure we put on ourselves as therapists can actually lead to lower self-confidence. So just kind of
Yeah.
remembering some of the basics, I think, is really important. As if you're transitioning to private practice from an agency work.
Mhm. So, like, I feel like these are good actionable things to do when our confidence is low. Can we talk about some more action steps we can take? Or reframes. Like, I love the idea of like all you have to do is connect and you're already winning. I love that as a reframe instead of like you have to be the best therapist that this client will ever see in their lives. Um, because I think too, like when we're less confident, sometimes it's harder to connect to people because we just don't feel safe all the way, you know?
For sure. One of the things that I try to do is I start from because I'm a big picture person. So I start from the big picture. I ask a question like, how do you believe that clients heal and change in therapy? So
Mm,
we just start there, and that in and of itself kind of taps into our deeper meaning as to why we get into this field in the first place. And everyone has a little bit of a different answer. And so if you ask that question of yourself, like, why did I get in this field in the first place? How do I believe that therapy helps?
mhm,
And so you're going back there and you're using that information um, to kind of move forward with your clients or in your private practice work. I think that's always a really big first step. You can certainly always do, for lack of a better word, you can do a treatment plan for yourself.
mhm,
You can kind of assess what are the areas that I feel really confident in, and what are the areas I don't feel as confident in. And then after that assessment, what do? You go toward the goal. What's my goal here? What's my goal in these areas I don't feel as confident in? Well, great. You got the goals. What's the interventions? What am I going to do to then feel more confident in these areas? There's
mhm,
lots of things. It may be a training. It may be seeking out specialized supervision or consultation, which I haven't touched on yet, but I feel like that can be very helpful in terms of the practical application of a lot of the stuff you're learning.
mhm,
You can do the case conceptualizations. You can just talk about the theory in general. You can bounce your ideas off peers if you're in a group. So I think that can be a tremendous kind of a technique for developing some of the confidence. Um, where was I with the treatment plan? Right. So yeah, the assessment, like goals, intervention, what are you going to do and how you're going to do it?
mhm,
And then kind of looking at what your timeline is finally for doing that. I want to get to this point in this goal. I want to get to this point where I have a system for assessment that I feel really good about in my practice. And then I'm going to work on the next thing because there's always a next thing.
mhm.
We like to
Yeah,
learn.
we do. We do. Thank goodness, right?
Yeah.
Yeah. So let's get into some of the like specialized supervision and those pieces because I think about like supervision and consultation, particularly consultation. Once you're fully licensed, we've talked about this on the podcast before. Like this doesn't mean you're done getting guidance. So can we talk some about supervision, how to find a good supervisor, like how to choose one over another, for instance, and
Mhm.
what kind of help you as a supervisor might provide?
Mhm. Yeah, those are great questions. I'm going to touch on consultation. So once you're fully
Mhm.
licensed, because
Yeah, yeah.
most people are able to find kind of clinical supervisors for them. So once you're fully licensed, the thing that I dread seeing is that once people get their license, they just stop all contact with any kind of consultation or supervision.
Hmm.
It
Yeah.
makes me so worried. It makes me worried for them. It makes me worried for their practice, makes me worried for their clients, makes me worried for potential legal and ethical challenges in the future. I guess that's my own soapbox. So,
So
but
box it
what,
up.
yeah, yeah, yeah. But what I'm saying is, I think actually that's where uh, either individual or group, group consultation can be really helpful if you're feeling isolated and if you're feeling you want other people's perspectives on cases and stuff like that. Individual clinical consultation, I recommend more for those cases where maybe you did just learn a new modality and you want to do some deep dives into your cases to figure out how you can use that particularly with your cases. Or
Mhm.
like an example I mentioned earlier before, you just don't have a great assessment process for
Mhm.
your clients because maybe you haven't done a whole lot of diagnostic assessments before. And so really trying to fine tune some of those processes and like I said, the practical applications of skills. So I think that's how consultation can really be useful. I hate to see any therapist practicing in isolation. Even advanced level therapists can benefit from,
Mhm.
being together with peers and continuing to learn more. Yes, the success of your private practice is often due to your business practices, how you build it up, very focused on marketing, the business related stuff. But if you're not a great therapist, it doesn't matter how good you are with
Mhm.
all that admin and business related stuff, you're not going to be successful as a therapist. So,
Yeah.
as a private practice therapist. So, really investing the time and energy into continuing to grow your clinical skills and learn how to apply those, as well as, of course, the burnout prevention, which we don't want anyone to be burnt out ever.
Mhm. Right. Yeah. And I think probably about once a month, I'll have somebody email me or message me on social and say, I'm getting calls, I'm converting them, and they're staying 2 sessions and leaving. Like, what do I need to implement to keep them? And I'm always like supervision or consultation because that's a clinical issue. And I'm trying to say it gently because I don't want them like that's what's happening is they're not taking care of the client and the way the client needs to be taken care of to stay. And that's a clinical issue. It's not a business practices issue. And so I think like anybody listening who's having that problem, like there's no shame in that. Like just like you first had to learn how to be a therapist, just how you first had to learn how to set a niche or market or do those first phone calls. There's just ongoing work you need to be doing in order to have the practice you want and to help your clients get results. That's all right. Like that's important and good. We should all be doing it. And you have some extra motivation to do it now. So yeah.
Yeah, and it's interesting. Some this is really state dependent, but some states will count ongoing consultation towards your professional development or CEUs.
Yeah.
That's
Yeah.
fantastic because
Hmm.
that's one of the most useful ways that it's not just kind of a one-time, thing. It's something that you're doing and developing on and on.
Yeah.
Consultation really works because of the relationship again. We talked
Hmm.
about the therapeutic relationship. That's why therapy works. Well, that's why consultation works. You're developing a relationship. You're starting to get to know and trust either your supervisor or your group or whoever it is you're doing consultation with. And that deeper relationship it helps you manage the tough times in your practice, the
Hmm.
tough clinical cases. It helps you figure out how you're going to respond to a potential ethical dilemma or a legal issue. We always hope none of this stuff comes up, but it does. You
Hmm.
will not go throughout your career without an ethical or a legal issue coming up where you're feeling your own depth on.
Yes.
And so just having someone and knowing that you have a relationship with someone or people that you trust to help you walk through some of these things,
Mhm.
that in and of itself is just going to give you some more confidence too.
Yeah, absolutely. I think about that clinical support also allowing you a little bit more spaciousness with who you work with. Like you don't feel as stuck with your niche, for instance. if you're getting to a place where you would like to change. You've got backup so that you can change and you can weather the shifts in your practice with some support.
Mhm.
I think that's really important for us to stay in the field, because I hear from people like, I don't want to work with the same population my whole career. Like, I never said you had to. You can always switch your niche, but you need one to get people in the door. So yeah, yeah,
Yeah, and having those people around you that you know and trust and you really feel like you can come to when you need to, it's like a safety net.
yeah.
So you're not out there practicing on your own. You have that safety net that's there if and when you need it.
Hmm. So if like every therapist were to take action on the thing you would want them to take action on, what would it be?
I would say to one thing,
One
narrow
thing,
it down to one
sorry,
thing.
no pressure. I
Um,
mean, it could be three. It could be three things. It could be however many you want.
I would say just making sure you're investing in yourself and your clinical work as much as you're investing in the other things. And when I say investing, it doesn't even necessarily mean money, but
Right.
it has to be some sort investing energy, investing time, could be investing money, into yourself. And what do you need to be successful and to continue to grow your confidence as a private practice therapist so that you can continue to be or become a fantastic therapist. So
Mhm.
whatever that looks like, for me, that's always been consultation, which is why I'm so passionate about it. Yes, I love learning new things in training, but I can quickly forget about the new things I learn unless I'm in a place where I'm applying what I learn. I mean, every time I still meet with my clinical supervisor regularly. Every time I meet with him, I think, oh my gosh, there's so much I don't know. I
Yeah.
just don't know so much. I've been in the field for 25 years. Like there's a lot I do know.
Mhm.
But it just makes me realize how much there still is to learn and to know. So I guess my one thing is figure out what that is, what that means for you,
Mhm.
what your ongoing investment, what you want it to look like. And then I think you touched on something earlier that I didn't answer really quick was how do you find someone?
Mhm.
So I really quick want to answer that. How do you find someone that you're looking for? Well, you got to figure out kind of what you're looking for first. Are you looking for just kind of generalized consultation? Are you looking for specific trainings? Are you looking for specialty supervision? What would be the most helpful for you? And what's your time availability and money availability to invest in that? Because of course, all of us want like, oh yeah, I want someone who's an absolute 100% expert on that, but I'm willing to pay $50 for that. So
Right.
you got to
Yeah,
match those two up for sure. And what is sustainable for the long term that's going to help me throughout my career. So not
absolutely.
looking at it like a temporary thing. Maybe you boost it up at
Mhm.
different times in your career. Maybe you decrease the frequency at other times in your career. But what do you want as a consistent support throughout your career?
Yeah. And if you're hearing this and you're like, I literally cannot even pay $50, how am I supposed to I like the idea of this, but I did a consultation group with two of my old coworkers, and we are like a psychologist, an LPC, and me, a social worker. We were in three different cities in two different states, two different niches, like two eating disorders, one sex therapy. But like we got so much out of it. We all like, because we already trusted each other. So you can find the people in your life already. In the meantime, like I think it's great to have a dedicated person if that's your ultimate goal. I think it's really good to have somebody maybe more senior than you to like walk you through some things, and to have that ongoing relationship. But if right now you can't make that happen, still keep growing, still like do what needs to be done to create your own peer led group soup. And that way everybody's taken care of.
Yeah, absolutely. I mean, peer consultation and supervision is just it's an amazing thing about our field. Not a lot of fields offer something like this. So if the commitment is there with you and your group and you feel like the fit is good, like absolutely, it can go on for years and years and years.
Yeah.
So that's definitely, again, I will say that takes less investment of money, but it does take more investment of time.
Hmm.
Because someone has to run the group, someone has to
Yep.
like get it there. So where can you invest,
Right.
time, money, energy, one of those things.
Yeah. Yeah. You got to have two of those three.
Yeah.
Yeah. Awesome. Well, Shannon, thank you so much. And people can find you. You're on social as Firelight Supervision. They can find you online at firelightsupervision.com. Do you have availability to supervise or consult with people?
Yes, definitely. We offer all of our consultation is virtual. So we offer both individual. We have 5 supervisors on our team. All of us are approved clinical supervisors who are, that means we've had a lot of training and experience doing supervision already. But our biggest offering is our clinical consultation groups, which is basically peer consultation, but is led and organized by a supervisor. So we keep our groups small. It's the same people you're meeting with day in and every month. And so you really get to know and trust those people. So those are great options if you're feeling isolated. Maybe you move to a new city, you don't know other therapists. Or that you just want no hassle. You just want to be like, I just want to come and I want to do this and show up every month and get what I need to out of it. So those are some of our offerings, but we also have a clinical confidence ebook
Ooh,
that we are
love it.
offering for free. So if you just go to our homepage of firelightsupervision.com, it's kind of right there, and we'd be happy to send that to you. It's pretty extensive, not going to lie, but it talks about lots of different areas related to clinical confidence in different theoretical orientations.
Fantastic. Thanks so much, Shannon. I appreciate it.
Thanks, Allison.